There we go.
Hello, everybody. It's Dr. Veronica, your holistic and functional medicine pharmacist. And I'm joined by Quyen Johnson, nurse practitioner at One Family Clinic. And
Hello, everyone.
we're excited that you're here with us today for another Feel Good Friday, and it's American Heart Month. And we're going to talk to you a little bit about blood pressure. So, would you please tell us why is blood pressure something important that we might want to be checking at home?
Because having high blood pressure is one of the most crucial factor that cause heart disease and heart attack. Having high blood pressure is a silent disease. So, if we don't usually check it, we don't really know it's high until it cause people to have symptoms. And so it's a very good thing to keep an eye on, to prevent heart disease and heart attack and stroke.
What are some of the signs and symptoms someone might have if their blood pressure was dangerously high?
Usually, people would have like headaches. Sometimes they might have blurry visions. Um, Sometimes they will get dizzy. And then, when it gets really, really bad, they will have chest pain, and other issues that some people can have, when it gets too high, they can have a major heart attack and it can, be life threatening.
Yeah. So I learned today that you offer free blood pressure screenings in your office.
Yes, absolutely. We provide that as a service for our regular patient or even, basically any patient. If you just want to get, patient just want to get their blood pressure checked, we provide that service free of charge. Because I think it's a very good way, to prevent heart disease. Like I said, it doesn't take very long. It just takes like 5 minutes. You just sit in the chair. That we put blood pressure cuff on you and check it. It doesn't take long at all, but it's very worthwhile in the long run.
Yes, because if you catch it early, that means you can make lifestyle changes or use a medication to help lower your blood pressure into a safer range. And then you have less wear and tear on your heart. I like to explain it to patients when we talk about high blood pressure, it's like running the hose on super high pressure. And when you have pressure in your water, it can do damage. It lifts up the dirt out of your driveway, gets stuff moving. So imagine if you're running high pressure on the insides of your vessels that are carrying your blood, you're damaging the lining of your blood vessel. And over time, that can begin to create scar tissue, and you get a stiffening and hardening of your blood vessels, and then they can't respond like they need to relax or contract nicely to make the changes that your body needs when it has to route blood differently.
Yes, yes, of course. And it's funny that you mentioned about the hose example because that's the same example I use for my patient.
All right.
So, yeah. So, a lot of time just because the arteries get hardened, then the plaque is, that is caused by cholesterol and other material it build up inside the arteries, so inside the holes. And, when those build up, then it can become blood clots. And when blockage happen, that's when people will have major heart problems.
So a heart attack is happening when we have complete loss of blood flow through one of the vessels that fuels the muscle of the heart. And so it's either blocked completely by plaque or buildup of sticky, fatty cholesterol junk, or it could be a blood clot that's not letting blood pass through. And then we get lack of oxygen and muscle death in our hearts. And depending on how much muscle death we have, it can be fatal, or it sets us up
Yes,
for
absolutely.
lifelong heart failure if we have too much death of the muscle related to the lack of oxygen. And chest pains are a sign that you're not getting enough oxygen to your heart muscle.
Yes, yes. And it's funny. It's funny sometimes in a woman. Sometimes women don't have obvious chest pain when they have heart attack. They might have abdominal pain. I've seen when I worked in the ER. I've seen a lot of cases when the patient came in and thought that she had a stomach bug, but it turned out she had a major heart attack. But she doesn't fit into the typical, when you imagine somebody with a heart attack, they will clutch their chest and say they have chest pain.
Mhm.
So for a woman, we have to really pay attention to those symptoms that we have when it comes to having a heart attack, heart problems.
I think that's a really good point to make because heart disease is a huge killer of women that I don't think is talked about enough.
Absolutely, absolutely. That's even sometimes it's feel like when people have heart attack, they might feel like they have acid reflux. I have patients who also told me that they have acid reflux, and they thought usually it's it's the stomach bug is usually the problem, get blamed on a lot, and they have acid reflux. But if that acid reflux feeling come with like dizziness or sweating, then you really have to pay attention, because that typically not a stomach bug problem. It's other thing that's going on.
Mhm.
That they so if that's the case, and I really recommend patient to go to the hospital to get checked out.
For our patients who are already taking medications for their heart, like blood pressure medications or diuretics that also help with blood pressure but can help with managed swelling, I recommend that they check their blood pressure every single day. And I get some patients that say, oh, well, I don't want to buy the machine. I've heard you tell me your patients will say they don't want to spend the money on the machine, but it's an investment in your health. And your blood pressure can serve as an early warning system. If you're checking it every single day, you may notice some changes, either your blood pressure going up or down, that can indicate that there's a problem about to happen. Because patients who end up in the emergency room with really high blood pressure, we call it a hypertensive emergency, it's unlikely that that hypertensive emergency just happened all at once. It was probably something that was gradually happening over several days, but because they weren't checking their blood pressure and noticing the subtle signs that their body was giving to them, and it gets to that point of being a hypertensive emergency. So I would like to encourage everybody, especially if you're already taking heart medicine, check your blood pressure every day and write it down and notice if there's a trend. If you see it going up or you see it going down and it's lower than usual, give the doctor a call, talk to the nurse, and just check in to make sure that there's not something more serious brewing.
I absolutely agree with that. Because like Dr. Veronica had mentioned, having high blood pressure is a silent disease, so sometimes we don't know until we get it checked.
And high blood pressure doesn't have to be something that we take medication for lifelong. There are many things that we can do to help with our blood pressure, like the foods that we eat and moving our bodies more are really important ways that we can help manage our blood pressure. And we might spend some more time next week talking about those. What do you think?
I think that's a great idea.
Okay. Well, thank you everyone for joining us. It is American Heart Month. I hope that you'll do something heart healthy. And if you don't have a provider, go see Quyen Johnson at her clinic, One Family Clinic, and get a health checkup. Get established with a provider so that you know you're keeping your heart safe. Thank you.
Thank you. All right.